Hi, my name is Ashley Sanders, and I'm a licensed mental health counselor in the state of Florida. I'm also one of the program managers over mental health for eTherapy. I have over a decade of experience in supporting student mental health within a school setting, and today I'm here to talk about risk assessments. We wanted to create this webinar as a refresher on suicide risk assessments and how to document them. This webinar is not meant to replace your own clinical expertise, state licensure requirements, or ethical guidelines, but it should serve as a reminder on how to navigate this difficult topic that may arise in your support of students. One of the toughest parts of being a mental health provider is assessing and supporting clients with suicidal ideation. This can be even more difficult when working with teenagers, especially within a school setting. Today, we will review how to conduct a risk assessment, appropriate documentation of a risk assessment, and what to do in situations where immediate crisis support is necessary. When working with students with any history of suicidal ideation, self-injurious behavior, or mood disorders, it is crucial to complete a risk assessment as a regular part of your session, every time. Never just assume that because a client didn't mention it, it's not a problem. For teenage clients with other presenting concerns, this is also important to check in on every time. Your younger clients without a history of these concerns may not require a risk assessment every visit, but always be on the lookout for signs that one is warranted. So look for things like depressed mood, a change in mood, talking about death, loss of interest in activities, giving away items. This topic is important to feel comfortable with. Many of the students we support are coming with presenting concerns that may increase the likelihood they are experiencing suicidal ideation. For example, suicidal ideation is part of the diagnostic criteria for major depressive disorder, so we would expect to see this with some of our students experiencing this challenge. Though our focus in this training is on a suicide risk assessment, please note you should also be assessing for homicidal ideation with students. In cases where they do indicate homicidal ideation, please reach out for more support. So let's talk about some steps in a risk assessment. First off, some general guidelines. Number one, acknowledge the student's distress. Number two, take statements seriously and do not minimize the comments. Number three, do not show shock. Number four, do not agree to keep things private or to confidentiality on this topic, because you cannot ensure that. Number five, always ensure that you know how to reach someone at the physical location of the student. And number six, be familiar with the risk and protective factors for the student, as well as potential warning signs. We've included a handout on this topic for more information. So the first step in a suicide risk assessment is to ask. When conducting risk assessments, it is really important to ask directly about suicide. Clearly asking, are you considering suicide? Or have you been thinking about killing yourself is very important. We do not want to just ask, are you thinking of hurting yourself? Because it's not as clear, and hurting yourself can mean a lot of different things to different people. Additionally, we want to make sure not to phrase it in such a way that we give the answer, or come off like we don't care. For example, you're not thinking of killing yourself, are you? For students with a history of self-injury, asking further questions about self-harm is important, but never skip the direct question about suicide. So, for example, if I think a student may have a history of self-harm and I'm doing a risk assessment, I will ask very clearly about both suicide and self-harm, and it'll sound something like this. Have you ever had thoughts about killing yourself? If they say yes, I'll ask for more details about when the last time they felt that way was, what was going on in their life at that moment in time, and how frequently these are happening. I'll also ask for more details, and we'll talk about that in a few minutes. Next, I'll also ask specifically about self-injury. For example, have you ever hurt yourself on purpose or thought about doing so? For example, some people may cut themselves when they are feeling sad. If they say yes, again, I look for more details about methods, last occurrence, and triggering events. I also gather information about the severity of the cuts, because though some self-injury is superficial in nature, other times the amount of damage inflicted can be more emergent in nature, even if the intent is not to kill themselves. So keep in mind that many people unintentionally cause significant harm. So even if previous injuries have been minor, the issue shouldn't be minimized. So when you're asking about suicide or self-injury, if the student says no, you're able to move on to the documentation part, which we're going to discuss later in this webinar. But if a student says yes, refuses to answer, or gives a non-committal answer, you will need to do some more digging. If a student says yes and confirms suicidal ideation, you will want to gather some more information. If the ideation is passive in nature, such as, sometimes I don't want to be alive but would never do anything, or there's days I just don't want to wake up, your focus will be on building resources, coping skills, and safety planning. But if they have more active ideation, you're going to want to check for intent, a plan, including their access to means and a timeline, and future oriented behaviors and coping skills. So, intent is a crucial variable in a risk assessment and in determining next steps for a student. For example, if a student reports ideation, but also reports they have no intent to follow through, that is really important to note. To ask about this, you can say, when you have these thoughts, have you felt like you are going to act on them? Next, to check for a plan, ask them if they have thought about how they might do this or if they have a plan. For example, asking if they have ever done anything or started doing things in order to prepare to end their life. If they do not have a plan, double check if they have ever had a plan in the past. If they do have a plan, you want to get more information about what that plan looks like. So, things you want to look for include the timeline with which they plan to carry out the plan. For example, Saturday night after the parents go to bed is a much more thought out plan and timeline than the next time I get in a fight with my best friend. And then you want to look for their access to means to complete the plan. For example, do they have access to guns, pills, drugs, etc.? Some means of suicide are easier to control for. For example, we can ensure that firearms are locked up or not available. But if a student has a plan to walk in front of a moving vehicle, we would have a harder time controlling that scenario since we don't control traffic. In general, a more thought out plan means higher risk, but this is not always the case. Students that have a history of substance misuse or impulsive behaviors may not have a plan. They can be equally at risk due to the potential of impaired thinking or impulsivity. I always like to include future oriented behaviors in a risk assessment. This means I look for things that the student has coming up that they are excited about or planning for. For example, upcoming dances, sporting events, or plans with friends. You can also look for long term goals, such as planning for college or career choices. They're really great examples of some future oriented behaviors. If a student has no future plans and indicates having nothing to look forward to, this is a huge warning sign. In addition, you will always want to gather information on coping skills they can use, people they can talk to when feeling down, and then collaboratively create a plan for next steps. Students may not have these resources in place or know how to develop them, which makes for an opportunity for you, the assessor, to help them create a safety plan. Finally, if they've indicated any level of ideation, plan, or intent, you will want them to contract for safety. If they are not able to do this, further intervention will be necessary. I also like to work with them on how we're going to discuss this with the school or family to help ensure their safety. By letting the student be part of this process, you are building trust and also ensuring their buy-in. But now that you have all this information after talking to the student, what do you do? Well, we're going to talk about documentation next. And first off, don't panic. Risk assessments, especially with teens, can be tough. They may give vague answers or incomplete information. Sometimes it may almost feel like they want to leave you on edge. In the case of no ideation, no plan, no intent, your job is pretty simple. You're going to document this very simply and clearly within the note. An example would be, student denied suicidal ideation plan or intent at this time. If the student reports ideation with no plan or intent, you'll want to again very simply state that the student reported suicidal ideation with no current plan or intent, and the student has the following things they are looking forward to, and then you'll list them out. Then you can say that student identified the following coping skills if they begin to feel this way, and list them out. And student will notify blank, and this should be a responsible adult that you fill in the blank with, if they start feeling like they have intent or plan. Student was able to contract for safety. One of the benefits of listing all these things out is that you can regularly go back each session and remember what your students' coping skills are, who their go-to person is, and what they're looking forward to. So what do you do if a student reports ideation with no current intent, but does report a former plan. You're going to want to document this as well. Student reported suicidal ideation. They reported no current intent, but did report a plan in the past. Student reported a plan of blank. You're going to want to include details of the plan in that blank, as well as mitigating factors. For example, use of a gun, but does not have access to one, use of pills, but does not have access to those, etc. You're going to also want to continue documenting the things that they're looking forward to and listing them out, their identified coping skills and listing them out, and then who they're going to notify if they feel that way. Again, it should be a responsible adult they can trust. You also want to document that you provided them a resource flyer with suicide hotlines. We're going to talk more about that flyer in a little bit. And you're going to want to document that they contracted for safety. Again, it's great if you've done this collaboratively, then you can document that student's guardian was notified of this concern with student's permission so they could monitor for safety. Again, the more adults in their life that can be aware and supporting the student, the better. So we're going to want to try to make that part of our process when we're getting to a risk assessment where we're worried about the level of risk that is presented. So what do you do if a student reports suicidal ideation with an active plan and active intent? Well, first off, you're going to want to move to crisis mode. You're going to follow the eTherapy crisis flowchart titled Individual Crisis Response for Suicide Risk, which details what to do for virtual and brick and mortar students. The really important thing to remember in any crisis scenario is that we want to ensure safety. So we would rather overreact than underreact. If we're able to physically verify a student's safety in the moment, so we can see them visually on screen, you may have a little bit more time to try to reach the appropriate people at the school, either using available contacts or even calling the front desk of the school. Or you can call the parent if your student is at home, because they're a virtual student or you're seeing them after school hours. But if you have lost visual access to the student, so they've signed off, they've left the room, and you cannot reach the school contacts or a parent that's present with them within 1 to 2 minutes, you're going to want to immediately call law enforcement for a wellness check. If you do reach school personnel, we're going to notify them of the concern and help them ensure a full risk assessment is completed in person following their school's guidelines. Then for a student at home with their guardians, we may need to walk them through keeping a student safe until they can access a mobile crisis team, the emergency room, a central receiving center, or law enforcement. Make sure that you're aware of available options within the student's community. This webinar cannot cover every single scenario that may occur in supporting students with suicidal ideation. I know that it is never comfortable to have a student with suicidal ideation leave your session. I always like to remind myself that we're not fortune tellers. The best we can do is to ask the right questions in the moment and then thoroughly document that at the time we met with an individual, they were safe. If we cannot say they were safe, we will utilize the crisis response plan outlined earlier. So as we conclude, remember these key points. Always ensure that you have contact information handy for your students, including phone numbers for school staff and parents, and the student's home address or the school's address. Be sure to complete a risk assessment in every session for students with a history of suicidal ideation, self-injurious behavior, or mood disorders. Always be sure to document your observations and above all, ensure safety for the student and others. And then please make sure to check out our flyer with the national suicide resources and a personalized resource plan that you can share with your students as needed. If you have a student or scenario in which you need more support, please feel free to reach out to your account manager who can connect you to one of our mental health program managers for additional clinical support. We know that your work is very challenging, so thank you for your dedication to making a positive change in students' lives. We value you, and we are here to support you in the important work you do with students every day.